Let me ask you something. What if I told you that for younger women, more than half of all heart attacks are not caused by the classic clogged artery we always hear about? Yeah, a huge 15-year study is making us rethink, well, pretty much everything. Let's get into it.
Seriously? Just for a second. Who pops into your head? What do they look like? How old are they? You know, that mental image we all have for different health conditions, it really, really matters. And as we're about to see, ours might be seriously out of date.
For decades, the story about heart attacks has been incredibly consistent, right? We've seen it in movies, on TV shows, probably even in our old health class textbooks.
We all know the scene, the sudden chest pain, grabbing the arm, and the cause is always the same. Years and years of plaque building up in the arteries, finally causing a blockage. The medical term for it is atherothrombosis, but you can just think of it as a clogged pipe.
Well, that's the big question. What if that classic image isn't the whole story? A group of researchers had a hunch that for patients under 65, and especially for women, something very different might be going on.
So you might be wondering, why zoom in on this specific group? Well, because when it comes to a heart attack, getting the diagnosis right isn't just important, it's everything.
And that's not just my opinion. This is a direct quote from the study. The researchers were worried that if doctors are working off an old, outdated stereotype, they might miss the real cause. And that misclassification can lead to treatments that don't just fail to help, they could actually cause harm.
Think of it like a plumbing problem in your house. How you fix it depends entirely on what's wrong. Is the pipe clogged with gunk, or is there a tear in the pipe wall itself? Those are two totally different problems that need two totally different solutions. It's the exact same idea here. Get the cause wrong, and you could end up with the wrong meds, the wrong procedures, and the wrong plan to stop it from happening again.
So, to figure this out, the researchers couldn't just do a small survey. They needed a really powerful and kind of unique way to get a clear picture.
So what they did was pretty incredible. They focused on one single county in Minnesota, which happens to be the home of the Mayo Clinic. Because of a special system they have there, researchers had access to the health records of pretty much every single person in the county. It's like having a perfect, real-world laboratory.
And they weren't just taking a quick snapshot. They looked at data over a massive 15-year span. I mean, think about that. 15 years. That gives you an unbelievably detailed movie of what was happening, not just a single picture.
And all that long-term digging allowed them to find every single person under the age of 65 who showed any sign of a heart injury. All in all, they built this incredibly detailed story from the records of almost 2,800 patients.
But here's the part that makes this study so powerful. They didn't just take the original diagnosis from the patient's chart at face value. No, two expert cardiologists went back and personally reviewed every case, all the imaging, all the tests, to figure out the true underlying cause. That level of detailed reinvestigation is almost unheard of.
So, after all that incredibly meticulous work, what did they find? Well, this is where it all pays off. This is where the story gets really, really interesting, and the difference between men and women becomes crystal clear.
Okay, first up, let's look at the men. You can think of this as our baseline. And what you're going to see is that their story lines up almost perfectly with that classic stereotype we've been talking about.
And yep, there it is. For men under 65, a full 75%, 3/4 of their heart attacks were caused by atherothrombosis. That's our clogged pipe. The next biggest chunk, that 19% for supply/demand mismatch, is basically when the heart isn't getting enough oxygen for some other reason, like maybe extreme stress or trauma.
Okay, so that's the picture for men. It's pretty much what we expected to see. Now, let's turn our attention to the women, and I'm telling you, prepare for a shock, because this is a completely different world. Just look at that. It's not even close. The classic clogged artery? For women under 65, that accounts for less than half of all heart attacks. The majority, more than half, are caused by something else. This is a massive finding. I really want to zoom in on that one slice of the pie, 11%. That means more than 1 in 10 heart attacks in younger women was caused by a condition that most people have never even heard of.
So what in the world is SCAD? Okay, back to the plumbing analogy. If a classic heart attack is a clog inside the pipe, SCAD is a tear in the wall of the pipe itself. Blood gets in between the layers of the artery wall, and that pressure squishes the artery shut from the outside. It's a completely different mechanical problem, which means it needs a completely different treatment.
And this might be the most alarming number in the whole study. The researchers found that because SCAD can be tricky to spot on standard tests, over half, 55% of these cases were initially misdiagnosed as something else. Just let that sink in. More than half of these women were likely starting off with the wrong treatment plan because the true cause was missed.
Now, whenever we see a study with findings this big, we have to take a breath and put on our critical thinking hats. Every study has its limits, so it's really important we talk about what this study does, and just as important, what it doesn't prove.
And to their credit, the authors are very clear about this. First, the population in this Minnesota county is mostly white, so we can't be sure these exact numbers apply to more diverse populations. For part of the study, they had to use an older, less sensitive blood test. And this study also couldn't include anyone who tragically died before they could even make it to a hospital. Being honest about these things is what makes science so trustworthy.
Okay, so with all of that important context in mind, what's the bottom line? What should we really walk away with after digging into all this?
It really comes down to this. We need to stop thinking of heart attack as one single thing. It's not a single story. It's a whole spectrum of conditions. And the big lesson here is that a heart attack, especially in a younger person, and most especially in a younger woman, is not automatically a clogged artery problem. It could be a tear, it could be a spasm, it could be something else entirely. And knowing the real cause is everything. It's what guides treatment and saves lives.
So, I guess I'll just leave you where we started, that mental picture of a heart attack patient we all have. Based on this research, it seems pretty clear the answer is yes, it is absolutely time for an update. It's a powerful reminder that we have to keep challenging our assumptions, because that's how we get closer to a truer and much more helpful understanding of how our bodies really work.